When it comes to healthcare, there are many ways to get care, with many organizations that provide different care for different needs, like primary care, ER, dental care, and behavioral health centers. When you have multiple health issues, you traditionally have to set up multiple appointments with different medical providers, and sometimes you traditionally only get help for some of your health concerns. When that happens, it is hard to get well. Although some concerns seem unrelated, they are all part of a whole person, a system, and it's hard for your healthcare provider to help you reach whole health and wellness unless they are aware of all of your health concerns. When they know about all of your health concerns, they are better prepared to suggest which options of care will be better suited for your recovery. There is a new approach, integrated healthcare. Our team of medical and behavioral health professionals treat individuals with multiple healthcare concerns. From primary care, mental health, and addictions, we treat the whole person, not just one healthcare issue. By taking this approach, you are offered coordinated care by one team at one location under one roof. So, you ask, what does integrated healthcare look like? Let's take a look. Meet Wendy. Wendy doesn't feel well. She has diabetes and bipolar disorder. Lately, Wendy has been sad and drained of energy. Last month, Wendy was in the hospital for complications with her diabetes. Now, she needs to fill her medications and wants to see someone about how she's been feeling. She could go to a health clinic to see her doctor and nutritionist for her diabetes, then go across town to see a psychiatrist and therapist for her bipolar disorder, then go back across town to the pharmacy to pick up her medications called in by her primary care provider and the psychiatrist. These appointments could be days, weeks, or even months away, and neither provider has medical records or will even discuss Wendy's other health concerns. While in the hospital, Wendy was given some health resources about integrated healthcare systems, where she could get primary care, mental health, substance abuse counseling, and even pick up her medications, all by one team, at one location, under one roof. When she gets to integrated healthcare systems, she meets Sharon, the medical receptionist. Sharon helps Wendy enroll in the center's care. Wendy tells Sharon how she was just in the hospital and why she has come in today. Wendy explains that she is depressed today and she wants to talk to a psychiatrist to get her medications for her bipolar disorder, depression, and she wants to speak with the doctor about her diabetes. Sharon gives Wendy a screening form, where Wendy shares that she drinks heavily but would like to stop. Sharon explains to Wendy that she will have a caring team of professionals all at the same location to help her achieve her health goals. Sharon then introduced Wendy to Rosalind the nurse. Rosalind takes Wendy blood sugar and is alarmed at how high it is. Wendy explains she has not checked her blood sugar for a week because she does not own a blood sugar monitor and can't afford one. Wendy tells Rosalind she would like to learn how to take better care of herself. Rosalind then checks with Wendy health insurance and sets up an appointment to see a doctor on that same day. Wendy then sees Dr. Armstrong. Dr. Armstrong gives Wendy a physical, and while she is doing that, Wendy talks with the doctor about her bipolar disorder, her heavy drinking, and her diabetes. Dr. Armstrong is concerned about Wendy's worsening symptoms of depression and steps out of the room to call a consultant psychiatric provider who suggests an increase in Wendy's antidepressant medications. Dr. Armstrong returns and discusses with Wendy her concerns, and they discuss a healthcare regimen. She then writes a new prescription for Wendy's diabetes medications and a new prescription for her antidepressant medications that was suggested by the psychiatric consultant, and suggests to Wendy to meet with Desmond, her colleague, to discuss her bipolar disorder and alcohol abuse. Dr. Armstrong advises Wendy that she would also discuss with Desmond about Wendy's diabetes, so that everyone is on the same page. She asks Wendy to check in with Rosalind every day that week, so together they could monitor her blood sugar. While Wendy is waiting on Desmond to come into the exam room, Rosalind comes in to discuss with Wendy about managing her blood sugar, give her tips about eating healthier, resources to help her with her alcohol addictions, and discusses with her the importance of taking her medications. Rosalind then introduces Wendy to Desmond, the center's licensed mental health counselor. Wendy feels comfortable enough to share her experiences and talks to Desmond about her recent symptoms. Desmond asks Wendy if they could meet on a weekly basis to discuss both her bipolar disorder and her alcohol abuse. Desmond also gives Wendy a list of nearby NAAA support groups to help her with reducing her drinking. At the conclusion, Rosalind, Dr. Armstrong, and Desmond all chart their record concerning Wendy in one electronic health record. Before she heads home, Wendy chats with Rosalind about scheduling her next appointments so that the team ensures Wendy continues to receive regular care. Then there is one last stop. Rosalind walks with Wendy and introduces Wendy to the on-site pharmacist, Dr. Mosley, to pick up her prescriptions. Dr. Mosley discusses with Wendy each medications, any warnings, any potential side effects, and advises her to call if she has any concerns. The entire team discussed Wendy's care plan and care progress in their regular weekly care meetings. Nurse Rosalind regularly checks in on Wendy to ensure that she has what she needs to manage her health and to help her feel better. On Wendy's next scheduled appointment, she feels comfortable discussing her health progress with Nurse Rosalind, Dr. Armstrong, and Desmond on how she is managing her diabetes with healthier eating. She has reduced her drinking, and she is taking her antidepressants on a regular basis, and her speaking with Desmond is improving her moods. Since becoming a patient of integrated healthcare systems, Wendy has not had to visit the emergency room for her diabetes. She has reduced her drinking, and her moods are more stable. Wendy is on her way to wellness. If you would like to learn more about integrated healthcare, schedule your appointment today. Integrated Healthcare Systems, 561-510-0471, or visit our website, integratedhcs.org.